Hi.
Hi,
How are you?
I'm good. We're back.
We're back. I have dealing with healthcare professionals on my mind. I have been
Tell us
doing
what's going on.
a lot of that lately. So, my mom, I wouldn't say late stage dementia, but she's getting there. Memory care, gets a kidney stone 2 weeks ago, emergency surgery in the ER, placed in the hospital, and then eventually put on hospice and sent back to memory care. But the amount of healthcare people that I talked to throughout all that, and I'm still talking to now that she's on hospice and in memory care. So there's like 2 teams of people working with her, and her memory care just cleaned house. Like the corporate people came in and were just started over with all new healthcare people. So wow, it's a lot. It's a lot. You have to be the point person for everything. You have to know when to advocate, know when to listen, and man, do you have to have your documentation ducks in a row. That's super helpful. So yeah, just kind of thinking about all of that. And then we encountered a lot of like, what would the patient want on this journey as well? But that's kind of more of a hospice conversation than a healthcare professional conversation. But yeah, yeah, I would say in the last 2 weeks, I've spoken to, met with, or just sort of casually dealt with 20, 25 different
Mm,
people that had
mm-hmm.
something to do with her health in the moment or in the future.
Right, right. So, in honor of our healthcare professional conversation day, I wore my corporate healthcare sweater, but I have disguised my corporate healthcare experience label here. But this is from my chaplain days, working as a chaplain in a hospital. So, I have some experience from a couple different angles with this question. Like, what is it like to handle the myriad of folks caring for our loved ones, whether in a healthcare setting, such as doctors? Now, there are healthcare settings like hospitals, but there are healthcare settings, like you said, dementia care. And then there's healthcare settings like regular appointments, physical therapy, occupational therapy, the different roles that people as they age need. The joke
Mhm.
is that what is a social calendar for an elderly person except a series of doctor's appointments?
Right.
So,
Yes. My mother got
yeah,
very excited for doctor's appointments. They were a highlight of her day.
and then
Mm.
everything from like, how are we getting there? Do we have mobility issues? How far is it to walk? What's the wait time when we get there? How long is our appointment going to last? What should we expect from the appointment? And then yeah, and then all the paperwork that comes in afterwards. So
Mhm.
what do you do with
Yeah.
all those explanation of benefits, and where do those go in the folder? It's hard enough to have your own, but then managing your loved one's paperwork is also a thing. So
Yeah.
we were talking about this and planning and thinking about our conversation today as we talked about your experience. And one thing that you were talking about was that organizational piece
Yeah.
and the
Yeah.
documents. So what
Yeah.
did you
So
have? What did you need?
yeah, so my parents were very organized and they were willing to talk about and have the question about their future. They were able to look at that. I know a lot of families or a lot of children of adult parents struggle to even have that conversation. Like, hey, you need to plan for this. And they're like, oh, I wouldn't want to bother you by planning. It's like, I'll bother you later by not planning. Yeah. So, but my parents were very proactive. So I had a healthcare power of attorney, which is just essential. That's the first question they would ask me as I was talking to them in the room. Are you the POA? Are you the HCPOA? Are you the PO? Yep, yep, yep. So I'm really glad I had that. And I had her passwords to all her different portals. So I had the password to the healthcare portal related to memory care. I had the password to her portal for her old doctor, the password to the portal for all her new doctors. And I also had a lot of good documentation from her about what she wanted. And I had a really thorough living will from her, which was super helpful. And she was also very organized about her medications. So I had a spreadsheet of medications and allergies. And then, once she could no longer update it, I was updating it, and I was able to do that. So I had a lot of good paperwork lined up, but I can't imagine what it's like if you don't. So like you stepped into your father's healthcare situation. I feel like you did not have there was no planning, no paperwork, no passwords, anything. Is that true?
I'm back.
Hi.
Yeah,
Yeah.
that's the way it was with my dad, just in and out. So, healthcare, yeah. So, somewhere along the way, after couple of his major hospitalizations and discharges to rehab for heart stuff, yeah, it was clear
Mm.
that I was going to be somewhere along for the ride and would need to coordinate his care as he progressed, not with dementia, but with some sort of confusion and just elderliness as he was heading out of his 70s into his 80s and a life of poor medical choices, I would say, and not much medical knowledge. So, coordinating his medicines, making sure which when they got renewed, how did he get them? When So, yeah, the medical stuff with my dad was complicated because he was not organized. And when I saw that finally getting some power of attorney paperwork, signing things like that, being around, that came through working with his senior center. They had someone come in and who introduced the process of some of the paperwork for seniors. In Ohio, which is where my dad was and where you are, every state has slightly different versions of things. So like in Massachusetts, they have a thing called a healthcare proxy. So that's
Mhm.
able to make different decisions. And they also have something called a MOLST form, which is Massachusetts something something, but it's about very specific, like a living will, but more specified. Like with this condition, we'll want dialysis. With this condition, we would, how much chemotherapy would we want under these circumstances if I could not make a decision for myself? So very much more specified list of things. We can throw that information up on the website so you could look and see the differences. But all that's to say is every time I've entered into talking with a doctor, having um, at least the healthcare power of attorney. And then there'll be other layers, at least in my experience. An insurance company, a healthcare insurance company, will want to have their own paperwork filled out so you could talk to them about the insurance process or get copies of that information. You might have a healthcare power of attorney, you might have a living will, you might have financial power of attorney paperwork as well. But many times, at least with the health insurance companies, they're going to want their own form filled out.
Mhm.
And having the power of attorney paperwork is a part of that. So where are you going to get your power of attorney paperwork? Your parents set that up, set the lawyer up or whatever. I had this interaction with someone at the senior center. Are easier ways to do that, but the basic is that you're going to want, at least for every hospitalization, you're going to have a chance to say, I am the representative. Please contact me about updates about my parents' care. Even if I'm not making decisions about my parents' care, I'm still involved. And your parent will say, yes, please let them know. And if they're unconscious, then they will need a contact person from the family to
Mhm.
have, or, from some relative, but the power of attorney paperwork's vital to that. What
Mhm.
other paperwork? Med list, you said? Insurance, you had
Yeah,
passwords.
I did. The passwords were
Electronic medical
important.
records make all of this change so different. Like
Yeah, I mean, in a lot of ways,
which level of the country are you in? Are you in the high earning level where everyone's got their electronic medical records connected? Are you working between hospital systems? My dad was working between a military base and a
mm,
public, or a local hospital. And so they didn't have communication. I had to constantly tell someone to fax documents across different healthcare systems. Same thing with sounds like maybe you've had that experience with the memory care. Who's like you updates discharge paperwork needs to be faxed to these people because is a paper copying going under your mother's pillow as she's getting sent from the hospital in a gurney to be delivered to her memory care. What's
yeah,
your
I can't
experience with that level of paperwork and like communicating between doctors and specialists?
Yeah, I can't imagine the VA plus and others. So my mom was part of a hospital system down south, and then that was independent, and then moved up with me 7 years ago and started getting involved in the Cleveland Clinic system. And so, yeah, so those 2 systems didn't talk to each other, and we finally just broke up with the doctors down there and just moved her so everything was in the portal and everything, just to make our own lives easier. Because my mom had dementia, that made a lot of these decisions easier because, I was the minute I got the passwords and both POAs, I just started going into everything and changing the emails. So, essentially, I got the passwords to everything that I needed access to, and then I immediately went into the settings and made sure my number was the double authentication, my email was the primary email, and I jumped through whatever hoops I had to do to get that done right away. So thankfully, now everything double authenticates to me and comes to me, and that was a really important step. And I did that way before this hospitalization, but it does make things easier because, you know, I was the contact, you know, I was instantly the contact person because I had made sure that that was all up to date, made sure the living will was in there, made sure the most recent insurance was in there. Yeah. So the digital piece, I think it's only going to get more and more important as we move forward. But yeah, dealing with the healthcare professionals from two sides of things and getting them to talk to one another is really hard. And what I've noticed too is that the more healthcare providers you have involved in, and I found this in my personal life as well, the less sort of individual accountability any of them really have. They'll start to kind of pass you around. And that's true in my mother's case as well. You know, we had a urologist do the emergency surgery and then they signed off when she went in the hospital. And the palliative care woman was like, they just signed off. And I was like, is that typical? And she's like, well, it's not ideal. You know, so basically they never did rounds. They never came back and saw her after the emergency surgery. They were like, done. You know, so that was weird. So I had to get on the phone with them and try and suck them back into the process, which I was able to do because I had a very nice scheduling lady. You know, so that was sort of like hurdle number one is one doctor just effed right off. And then, you know, as hospice came in and tried to layer in with what her memory care was doing, they are still kind of passing things back and forth. Well, that's them. No, that's us. No, that's them. No, that's could we test her for UTI? Well, we don't do that. They do that. What? They don't do that? You know. And so I'm just constantly refereeing all this
Mm.
kind of stuff. And
And
yeah,
you were on
so
site for
it's
all
hard to
that.
prepare for that, you know?
Yeah, but you were on site for all that. You were in person.
That's the thing, yeah, and I felt like I had to be, like, I literally took off a week of work and sat in that hospital room because there were, like, 5 or 6 people that came every single day, and some of them called, and some of them did not call, or they called the first time and never called again. So if
Mhm.
I wasn't there being an advocate, like, it wasn't happening,
Mhm.
and that was
So this is reminding me something that many people don't even know. You know, our generation, very few of us in our generation have had intensive experiences with hospitals. We might have primary care, we might have a specialist, we might have a physical therapist or appointment, or maybe something we've gone through. Thank goodness, you know, the 40s and 50s have been a relatively peaceful time for most of us. And so seeing our parents interact with these very complicated medical systems now does leave you sort of wondering. So, you know, things like when your parent goes into the emergency department, you know, they take as you took their they took your mother in because she was complaining of stomach pain, and then you went and joined her at the emergency department. How long were you there for? How long?
in the ER?
Yeah.
Only 10 hours?
Right, and that's quick. That can be quick until they decided to admit her.
Right. 7
Right.
AM, they admitted her around
Mhm.
5 PM. Yeah.
So, you know, from that place on, emergency departments and what they're like and getting there and then walking with your, you know, maybe they've broken a wrist or something by falling. Maybe you don't know if they've broken something by falling. They've banged up their head. That was always my mom's favorite activity was to cut something on her face when she tipped over and need some stitches somewhere, and so she'd drive herself to the ED, and then I'd find out, you know, that she spent the night in the ED waiting to, you know, get her face stitched up and them doing a CT scan because 'cause they're gonna scan your brain every time you fall if you hit your head, because they have to
Mhm.
check for internal bleeding all the time. So, you know, if your loved one falls and, you know, did you hit your head? You should go to the ED, they say. And then, like, think about all the insurance things that just show up because you've taken someone to the ED.
Oh, I have a story about that. Can I tell it really quick? So
Yeah,
my
please.
friend, I won't say her name, but my friend, her mom's was on Medicaid, and to get a trip in the ambulance to the ER from her assisted living facility was an uncovered cost. But if my friend went in and it had to be a certain kind of emergency for that to be covered, like, once she got to the ER. So she would take the the taxi of the ambulance to the ER, and then it ended up not being a big deal. Medicaid was like, you made the wrong decision. You're going to pay $6,000 for that ride." So my friend was constantly like, hyper vigilant about what she had to like remove herself from life to go do versus what they could call the ambulance in to do. So there's just yet another example. And I'm so sorry to interrupt you, but like, yeah, it just made me think of that.
No, no, you're absolutely right. Like, the woo-woo wagon is not cheap.
No.
So many people don't even think, but there are definitely reasons why you would call an emergency, emergency medical system, EMS, to have them come collect your loved one if they can't be moved,
Mhm.
personally moved. You can maybe call the hospital itself, talk to someone in the ED. But yeah, to do an assessment over the phone to find out who the people, is this a good time to call? They're going to default to the safety thing, I'm going to tell you. But so many people have not gotten the care that they need because they were concerned about the cost of emergency services. It's a good question, and knowing a little bit in advance about your insurance to make that assessment and is a good place to start. And then when you get into the hospital system, when you find out where your loved one is, there's going to be a phone in the room and you're going to call the operator to find out, you can get the room number, or you can just tell the person their name and they'll connect you to the room. But you can also ask to talk to someone to connect me to the nurses station. That will also get you to a person to find out who's their nurse on duty today. Can you talk to the nurse if you can't talk to your loved one, if they're not maybe coherent enough, if you're at a distance and you don't believe that you're going to get the most up-to-date information, you can call and ask for the nurse on duty that's caring for your loved one. How are they doing today? Have they been awake? Have they eaten anything? What's going on for them? And you can also ask for the doctor who's who's taking care of your loved one, ask them to call you back. And if they're not, often rounds are very early in the morning before you would even get but they should give you a call sometime during the day, maybe in the afternoon after they've completed their rounds. That's another place to get updates and information. When I was looking after my dad at a at a distance before, we didn't have portals to get the update information, and some things are going to show up in a portal and some things are not. But yeah, I learned to navigate the healthcare professionals in the building, right? So who is the nurse on duty? When are they starting their shift? When will they complete their shift? Will that nurse be back tomorrow, perhaps? Or are we gonna change nurses? Because that's a big deal to learn, new nurses, and we're getting to know your dad today. So but they're gonna have your information in the system to call if there's something serious that happens. But checking in during the morning, nurse shift often starts at 7 o'clock. You don't want to bother a nurse between 7 and 9 a.m. They're getting breakfast, they're getting to know their patient, they're getting to know their med list, what they needed today. After 9 o'clock is a great time to call a nurse and get a little bit more of an update. So the rhythms of any medical setting they're gonna be there. And so knowing when, you'll learn a little bit about when the rhythms are to find out when someone's reachable to get the newest information.
Yeah.
You have an
Yeah.
experience with that?
Yeah, just nodding along. Yeah, the 7 o'clock shift change is very real in both the hospital setting and the memory care setting as well. And then just I remember just needing to be there by 6:30 if I wanted to catch those doctors, 6:30 a.m. So I don't know how you did it, Holly, from a distance. I really felt like I had to physically be in the room, which I obviously didn't need to be, and I'm not going to be able to be if she goes back into the hospital because I took a full week off work, which is not sustainable. But you had to do so much of this from a distance. And it's great to hear you talk about it because I think a lot of people have to do it from a distance. They can't just drop everything and go across the country to sit by someone's bedside. So being able to call, it's huge.
Yeah. One of the other unsung resources is, does your parent have a primary care? And
Mhm.
how connected is your parent to their primary care doctor? Because getting that information or talking with your primary care doctor while they're in a hospitalization situation, when they're hospitalized, they're going to and this is something my dad and my mom never understood, is that they got discharged with different medications than they were used to taking when they were in the hospital. That's another
Mm.
thing, right? So you're in the hospital and you're getting treated for your heart condition, and they put you on this much Lasix or furosemide, also known as a water pill, to let go of the fluid that can build up during a heart condition. And so then they send you home with different medications, different doses. And then they may even give you a little bag with the medication in it for the first week until you can get to the or they send you with a prescription, or we sent that to your pharmacy, you need to go pick it up. And so then they get these new prescriptions and they're like, "What are we doing? Why did this all change? Who changed all my medications?" And you're like, "Well, you just had a medical event and we're going to like they set you at this because this is where you've been in the hospital and you may need to be down here and then you're going to need to follow up with your primary care who made these prescriptions." So, you're going to see a cardiologist in the hospital that's not going to be your primary cardiologist when you get home, unless you have some magical relationship with your primary cardiologist and they visited you in the hospital. That's unreal.
Yeah.
Having that back and forth, noticing that you're going to get different medications discharged, there's a chance. And so you go in with one list of meds and you're going to go out with a different list of meds, maybe with different, because you might have been treated for a new condition.
Mhm.
So then you have to follow up with your primary care doctor. You have to follow up with your specialist to find out what's going on with those new things. And if you're not, your elderly person, even if they're aging, right? So things are going to change as they age, whether or not they're in your care or not. You're going to get phone calls from your parents going, "They changed my medication. I don't know what I'm doing anymore." And they're going to complain. My parents love to complain to me because I'm an easy person to get on the phone. It's
Mm.
hard to get a doctor on the phone. So they're not going to call their doctor and complain unless they have a lovely relationship with their doctor and they don't mind calling. No, they're going to complain they complain to me first because
Mm.
I'm a listening person and I'm going to try to help them figure out what's wrong. And sometimes I just shrug and go, "You have to talk to your doctor about that. I have no idea. I am not a medical professional. I do not prescribe medications. I do not know anything about heart disease other than what I've read on the internet and do not trust that." So this back and forth with doctors, having at least knowing that there are phone numbers for who your parents' doctor is, what their phone number is a good start so that if you got into that situation, you can do a three-way call. "Mom, let's try to call your doctor on the phone." Okay, so my mom, still like compass mentis, can still talk and have these whole conversations, but doesn't track all the detail that I'm going to track and be attentive to. "Let's do a three-way call, Mom, with your doctor. Let's call." "Okay, Mom, we're all here together now. Mom, say hi. This is the nurse practitioner on the phone, Tisha," or whatever. And so, okay, now Tisha, I'm just going to say, "This is Holly," and I'm going to say some things about what I've seen in my mom or what's questions that she's brought to me. And let's talk through what's going on with her right now. Or let's find a time to call. Do we need to make an appointment? Does she need to see you? Can we put me on speakerphone when she has the doctor's appointment? That's all remote stuff that you can do. But doing that during your workday, it's going to be a pain. It's going to be awkward.
Yeah.
It might not work to your schedule. And so getting follow-up calls. "Mom's going to go in. Can someone please call me back?" Phone tag with the doctor is, of course, a difficult thing. So, making sure that you recognize the phone number when the doctor calls can be also a thing. So that's a lot. These are all little tricks of the trade or something experience. I've talked with my friend who's got a parent completely on the other coast, across the country completely, and discharging from the hospital with a broken phone to coordinate in-home care. "Oh, yeah, I've got friends coming by. The physical therapist is coming by." But assessing, mom is like, "Hey, I can do everything. I can drive in 2 weeks. It'll be fine." Probably not. How do you have then the conversation when you have to work around your parent who may not have an accurate representation of their own experience? And say, "I'm a little worried about mom driving." You can't convince mom to stop driving, maybe right away on that post fall, but you can say, "Have you talked to the occupational therapist? Have you talked to the physical therapist? What did they say about these things? What did the doctor say about these things?" And also, always at the end of the day, recognizing that you are not your parent and that your parent will have their own journey at the and so if they don't have the same perspective on their situation that you do, at the end of the day, that is their perspective and their experience, and letting them having their own experience of whatever their health situation is This is another conversation for us another time, Rocky, but definitely something in the word of boundaries or limits or places where you just can't go
Mhm.
simply
Yeah.
because it will cause more pain to keep going than just to stop.
Yeah.
So that includes healthcare professionals,
Indeed.
So patient-centered care as they practice in hospitals these days means that the patient really is the one in charge and we're focused on the patient. So it's not what daughter thinks is best, it's what everyone thinks is best for parent. And
Mhm.
parent needs is the one who's at the center of the story, not the daughter, not the son or the child.
Right on. Yeah. Yeah.
If you had to wrap up one, like, from your mom's hospitalization now that she's been back in her memory unit there for, I guess, a week, and you look back, how would you give advice to someone in your situation to manage your own experience in that setting? What would you need? What would you have known for yourself going in and coming out?
Palliative care and hospice are your friends with an aging parent. Check in with them maybe sooner than later during your hospital stay. Especially if your parent is farther along in their journey of life and this is like not their first time to the hospital. Maybe this is their second or their third time in the last couple of months. Yeah, just ask about palliative care. And when I got to the ER, they asked me right away. They said, "Do you want to see a palliative care doctor?" And I was like, "No, not yet." But I should have. I
Because
should have
that's an
talked to them right then.
important distinction. As we finish out today, maybe we can pick this up again. The difference between palliative care and hospice. Many
Yeah.
people think that they're the same. Palliative care is about comfort in one's medical treatment plan. So it's
Mm,
pain management, it's symptom management, it's palliative. It's about making things easier for the patient. Hospice is about end of life, dying things. Palliative care can cooperate with hospice, but those are two different things. And palliative care operates for cancer patients, people with conditions that are need symptom management over time. Your mom's kidney stone, that's a pain management problem. So, not a hospice problem per se, right?
right.
Shouldn't die from a kidney stone anymore. This is the 21st century. But there are things that can happen, and unfortunately, many people don't know the difference, and even medical professionals may or may not make that distinction. They may think you're saying one thing to the other thing. And so saying, "Look, we've got some symptoms here," is palliative care. To the palliative nurse practitioner or doctor, are they available to talk about what it could be make my mom more comfortable as she has this treatment plan?
Yeah. Yeah. 100%.
We can do this again.
Let's do this again sometime. All right.
Cool.
Bye.
Bye.